Hi friends, welcome to my channel. In this video, I am going to explain you about the postmortem findings in case of sheep in brief, especially in the field conditions. I am doing this postmortem with a simple BP blade and handle. So before opening the carcass, we have to observe the body of the animal. So if there are any hemorrhages from the natural orifices like rectum and the mouth and nasal cavity, and we have to rule out the anthrax by this. And if there are any external wounds that have led to the hemorrhagic shock of the animal, so that also we have to rule out. So it may be due to an accident or dog bites or a severe thorn injuries like that. After that, place the carcass on the floor and spread the forelimbs and hind limbs away from the body by disarticulating them from the shoulder and hip joints, and remove the skin from the breastbone to the throughout the ventral region, and observe for any hemorrhages present on the muscles. Locate the sternal cartilage, that is the gyphoid cartilage of the sternum, and just beneath that make an incision, and without puncturing the internal organs, just open the peritoneum, cut the peritoneum, and look into the internal organs. At this point, if we find any fluid in this peritoneum, then we can say that it is an ascites, and it may be due to the hypoproteinemic conditions and the liver dysfunctions, so which may lead to the accumulation of the fluids in the peritoneum. And after that, if we closely look into the internal organs, this is the liver, and that soft glistening appearance is the diaphragm, and here this is the abomasum, and this is the rumen, and this is the spleen. Without puncturing the stomach, I am directly going into the thoracic cavity. So the diaphragm I am cutting here. So after cutting the diaphragm, if we observe into the thoracic cavity, if there is any fluid accumulated in the pleura, then it is also considered as an hypoproteinemic condition. If possible, break open the sternum, or if not possible, just hold the trachea with one hand and incise the trachea with a BP blade by inserting the BP blade, and take out the contents of the thoracic with the hand pressure by holding the trachea, and observe the trachea by pressing it, and observe the contents of the trachea if there are any froth is there, and also observe the lungs condition and the heart condition. So in this case, here you see the lungs, one of the lobe of the lung is consolidated completely, and there is a pus formation and consolidation. Similarly, cut open the lung surfaces and observe the alveoli. By pressing the alveoli, if there is any froth, we can see it. And with the help of a scissors or the BP blade, we are going to cut the trachea up to the bronchioles, and observe if there is any froth inside the bronchioles, because this froth, if it is blocking the bronchioles and alveoli, it leads to the death of the animal because of asphyxia, and this condition we call it as a pulmonary edema or the pneumonia. Cut open the pericardial sac and remove the pericardial sac completely, and observe if there are any external hemorrhagic patches on the heart. And if we see here the heart, it is the left ventricle, left auricle, and the right ventricle and the right auricle, the four chambers of the heart, and we have to incise the heart in such a way that all the four chambers should be visible in the cut section, and observe if there are any abnormal blood clots within the heart chambers, or if there are any petechial hemorrhages on the endocardial walls. After the thoracic cavity, we go into the abdominal cavity. First we see the gallbladder. If there is any enlargement, then it indicates the starvation of the animal. Observe the surface of the liver for liver flukes. So if it is there, it appears in like this in the cut sections, the liver flukes. So but here this is a normal liver. And separate the kidneys. Take out the two kidneys and try to remove the renal capsule from the kidney by peeling it off by taking an incision. So while peeling it off, if the capsule is coming freely, then it is okay. If it is not coming freely and if there are any adhesions of the capsule with the renal cortex, then it indicates chronic or the acute nephritis conditions, which may be due to some poisoning or the toxicity. After removing the capsule, place the kidney on the floor on the surface and try to pour the water on the cortex of the kidney. And if it is a pulpy kidney disease, what we can see in the introtoxemia cases, this water pressure also makes holes into the cortex. And observe the intestines. If there is any congestion or any tape forms inside the small intestines, and identify the blind end of the small intestine, that is the cecum, and make an incision into the cecum with a blade or the scissors, and observe the mucosa of the cecum. If there are zebra markings hemorrhages, then we can confirm it as a PPR disease in sheep. Locate the four chambers of the stomach and identify the abomasal and intestinal junction, and cut open and observe the mucosa of this junction so that we can see the immature amphistomes. Are their larvae, their impressions on the mucosa, and go into the abomasum by opening the mucosa, and the abomasal folds will looks like this, and just spill out the contents of the abomasum. And if we pour some water, then we can observe if there are any hemancus worms, that is the thread like worms, red and white color thread like worms on the mucosa of the abomasum. And if there are any milk clots in the abomasum, that indicates the clostridial infection. This we can see mostly in case of lambs. And if we go through the abomasum, we can enter into the omasum, that is the leaf-like mucosal folds we can see there in the omasum. This pouch present adjacent to the rumen is the reticulum. As we know that the reticulum contains the honeycomb-like mucosal folds. So those things we can appreciate very well here. And in this portion of the stomach also we can see the amphistomes if there is any severe infestation of the amphistomes. And through the reticulum we can go into the rumen. And if we see here, there are many undigested maize seeds are there. And if there is a severe amphistome infestation, then these amphistomes will be adhering to the mucosa of the rumen. If the animal was suffering from severe vitamin and mineral deficiency, it takes its own hair, and this hair forms into a ball-like structure in the rumen. Like this, if we conduct the postmortems regularly to the dead animals, we can give a better treatment to the animals that are alive, and we can relieve their suffering. If you like this video, press the like button, and if you have not yet subscribed to my channel, please press the subscribe button and share the video to the needy. Thank you for watching the video.